ADHD is one of the most common neurodevelopmental disorders of childhood. It is usually first diagnosed in childhood and often lasts into adulthood. Children with ADHD may have trouble paying attention, controlling impulsive behaviors, and they may act without thinking about what the result will be or be overly active. ADHD happens because their prefrontal cortex is not normal. It is either they are understimulated or they are overly stimulated. So the prefrontal cortex is, in short, PFC. It plays a central role in cognitive control functions, and dopamine in the prefrontal cortex modulates cognitive control, thereby influencing attention and impulsive inhibitions. When prefrontal cortex is understimulated, the children start to show impulsiveness or inattention, not concentrating well to school, or they become hyperactive. We can treat this with these medicines. These are psychostimulants, atomoxetine, guaifenesin, and modafinil. So when you are using this medicine for the people who have understimulated prefrontal cortex, then we can make kids awake and alert again so they can focus and concentrate in class or work. On the other hand, when prefrontal cortex is overstimulated, and it is not just for kids and adults too, this happens in adults too, it'll show bipolar, anxiety, and substance abuse. And we treat this with atomoxetine and guaifenesin. Especially when adults are having ADHD, we are using medicine to cure this.